Hello, this is Annette again. Young people as a group constitutes the largest population in history with approximately 1.8 billion between the age of 10 and 24 years, or 1/4 of the world's population. This is partly explained by reduction in infectious diseases, malnutrition, and early childhood death. Around 85 to 90% of young people live in low or middle income countries. Adolescent populations are growing fastest in sub-Saharan Africa and the least developed countries overall. Approximately 60% of all youth live in Asia. For example, China and India alone have 225, respectively 235 million youth. The remaining 23% live in Africa, Latin America, and the Caribbean. The period between the age at first sexual intercourse and marriage is increasing. Albeit more in high-income countries, this is a worldwide trend. Young people delay their marriage for various reasons. Longer schooling period or increased living costs are some of the reasons. Delaying marriage also has implications for sexual and reproductive health, as the period of premarital sex, when young people often engage in unsafe sexual practices, is longer. This has led to an increase in sexually transmitted infections and unwanted pregnancies in this group. In most parts of the world, young men and women have their first experience of sexual intercourse in their late teens, 15 to 19 years, but there are differences between regions and gender. Women in countries with early marriage generally have a lower median age for sexual debut, and men more than women gain sexual experience through premarital relations. On a global level, but excluding China, 11% of all girls have had sex before the age of 15. In Latin America, the figure is 22%. In sub-Saharan Africa, 12%. And in South Asia, 8%. Today's generation of young people face new challenges compared to the challenges of previous generations. Increased globalization, urbanization, and influence of mass media have an impact on their lives. Social norms and traditional family ties are challenged and as a result eventually transformed. This creates societal shifts with new ways to live and new ways to have families. Young people globally have a disproportionately high burden of poor sexual and reproductive health outcomes. For example, teenage girls aged 15 to 19 years account for 11% of all births globally, and 95% of these occur in low and middle income countries. At a global level, complications related to pregnancy and childbirth are the second leading cause of death among 15 to 19 years olds. Adolescents account for 14% of all unsafe abortions globally, and up to 65% of women with obstetric fistula develop this already as adolescents. Today, young people account for 40% of all new HIV infections in the world, and each year at least 111 million new cases of curable sexual infections occur among this group. Survey data from 64 countries indicate that only 40% of males and 38% of females aged 15 to 24 had accurate and comprehensive knowledge about HIV and its prevention. 1/3 of the world's girls are married before the age of 18, and 1 in 9 are married before the age of 15, which leads to many maternal and newborn complications. And more than 125 million girls and women have been subjected to female genital mutilation, which is the partial or total removal of the female external genitalia for non-medical purposes. If current trends continue, more than 50 million girls are at risk of female genital mutilation before their 15th birthday. It is important to understand what factors have the strongest influence on young people's health today. Some of the most important factors are national wealth, income inequality, and access to education. These form the basis for the opportunities young people have. However, biological and social factors also influence the health of young people. Young people's bodies are still developing, which makes them more susceptible to STI infection compared to adults, in particular girls whose cervixes are still growing and forming. But adolescence is also a time when we undergo a great many psychological changes, and this is stressful. There is a consensus in the scientific literature that young people are more affected by stressful situations than adults, especially in the presence of peers and peer pressure, which in turn might affect their ability to make decisions based on long-term gains. But empowerment is also an important influence. We know from studies in various settings that when young people's right to sexual education and sexual health services is protected, they have better sexual and reproductive health outcomes. As a young person, you need to have access to confidential and private services that give information about various aspects related to sexual and reproductive health. Some countries have specifically trained counselors that work at youth clinics and meet with youth clients in connection with, for example, STI testing to provide advice and counseling. Counselors can also refer them to more specialized services if these are required. In societies where young people's sexuality is frowned upon and seen as something negative, they often lack access to contraceptives, counseling, and treatment, which in turn creates a vicious circle of untreated sexually transmitted infections. Unwanted pregnancies, unsafe abortion, and forced marriages. Why is there resistance? This can be for many different reasons. Sometimes there is a strong religious or cultural taboo around premarital sex, and SRHR information and services targeting youth are seen as promoting and encouraging young people to have sex. Sometimes it's a political question. Young people's sexual and reproductive health and rights are not prioritized and not enough resources are allocated. Investing in young people's SRHR requires a holistic approach where risk factors are addressed and protective factors in the environment are provided. It requires actors from all levels, family, community, and the larger society to acknowledge young people's need for information and services that are adequate, accessible, affordable, and appropriate.